How to perform a measurement for a full-length insole. The FITS full-length insoles are full-length 3D printed devices that allow you to add a medial or lateral forefoot wedge to the design of your insoles. The full-length protocol will give you an idea of the needed correction in the forefoot and is an excellent addition to a cycling shoe fitting. Our full-length insoles are specifically made for more rigid shoes, like a cycling shoe or a ski boot. They should not be recommended in regular everyday shoes. For the full-length protocol, we advise taking a walking and a running measurement, both barefoot. The walking measurement will act as a backup. The running measurement will be used when making the insole's design. A unique feature of the full-length protocol is the single-leg squat. It is intended to simulate, for example, stepping on a bicycle's pedals or the patient's alpine skiing position. When explaining this measurement to your patient, make sure to stress that it's not a training exercise for them. You want to test their balance in the forefoot when performing the squat. It's best to put something in front of them, a chair for example, so it's easier to keep balance. Also, ask them to lean towards their forefoot as much as possible. The full-length protocol is performed in 6 steps, which must be followed within the same time interval. 1. Do a side step on the foot scan plate with foot A. 2. Bend the knee of foot B and raise the leg to make sure it is not influencing the measurement. 3. Bend knee A to start the squat. 4. Extend knee A to end the squat. 5. Place foot B next to the foot scan plate. 6. Position foot A next to foot B. The patient's position is back at the starting point. Try to have at least 3 steps per foot, making sure you measure left and right in separate sessions. This will make it easier to evaluate the results afterward.